So this is a quick video to help you prepare for your sub-Q, IM, and IV push check off. The first thing that you're going to do as the RN is always verify your order. So I've got my patient's MAR pulled up and I'm verifying the order against the MAR before I go into the patient's room to explain a little bit and get some more information. All right, so the first thing I'll do before I enter the room is perform some hand hygiene and knock on the door. Hi there, Miss Jones. My name is Megan. I'm going to be your nurse today.
Nice to meet you.
How are you doing?
I'm doing good.
Good. I just wanted to ask you your name and date of birth before I begin.
Chris Jones, birth date 1/25XX.
Wonderful. And are you allergic to anything?
Penicillin gives me a bad rash.
Penicillin. Okay, we will not be giving you any of that today. Are you having any pain anywhere right now?
No.
Okay, wonderful. Well, the doctor ordered for you to get a few
Just
different.
hungry.
You're hungry? Okay. Well, we'll get your lunch ordered. The provider ordered for you to get a flu shot and insulin, and then you're also due for your Lasix IV. So I'll explain a little bit more about each of those medications when I come back with them. Is there anything right now you need in the meantime before I go get them?
Just hungry.
Just hungry. Okay. Well, we'll order your lunch, and we'll be right back. All right. Here's your call light, and I'll see you in a few minutes. Okay, so now I'm going to step over to the medication room, and what we're going to do is get our MAR up where we can start getting ready with all our medications. Okay, so I've already verified my order, so I'm going to start with the subcutaneous medication. So what I want to do first is look at the order, and I can see that I've got an order for insulin sub-Q. I know that insulin is a short-acting medication, and it's going to start to work within 30 minutes. So I want to make sure that the patient A is able to eat, that they're not nauseous or vomiting, and that their food is either on their way or already there. So I've got my insulin. A critical assessment you as the nurse would need to do first is a blood sugar. So I can see in my computer that the PCT just checked the blood sugar and it's 200. So based on the sliding scale, I'm going to be giving the patient 4 units of regular insulin for that blood sugar of 200. Okay, so I'm going to start by getting my medication. So I've got regular insulin for my patient Chris Jones, and it's not expired. So I've got the right patient, the right medication, insulin. I'm going to be giving 4 units sub-Q right now before lunchtime, and it's noon. Okay, so I've got all of those. The right reason is because my patient is diabetic, and we've done all the critical assessments. We know the blood sugar, and we know that her lunch is on the way. Okay, so that was check 1. Now, before I can do check 2, I need to wash my hands and draw up the medication. So I know since in sub-Q, the ranges will be from 25 to 30 gauge needle and anywhere from 3/8 up to 1-inch needle, depending on the size of my patient. Now, because I'm giving insulin, I can only use an insulin syringe to prepare my medication. But my insulin syringe is 29 gauge and 1/2 inch needle, so that will work perfectly for what we need. So I've washed my hands. I'm going to take an alcohol swab and clean the top, like so. And then remember, always put in air what you're going to be taking out in volume. So since I'm going to be giving her 4 units, I'm going to go ahead and pull up 4 units of air. And then while the insulin is down on the table, I'm going to go ahead and inject the air and very carefully invert it. Remember that these needles can bend easily, so you don't want to bend it. Now I'm going to go ahead and pull back a little bit more of what I need. And what that allows me to do is when I flick it, I can get the bubbles to the top, and then I can push up to the medication to the amount that I need, which is 4 units. And it pushed any bubbles that I had right back up into the vial. Know that if you're mixing insulins, you cannot do this. That's only if you have one medication. So I've got my 4 units, and I'm going to go ahead and recap it using the scoop method. And now that I've got it prepared, I'm ready for check 2. So I've got for Chris Jones, I've got regular insulin, 4 units, sub-Q, to be given now at noon prior to lunch. Okay, so with that medication, I've got check 1 and 2 done. It's prepared, and I'm ready to go on to the next medication. The next one that I can see that is due for my patient is Fluzone. So I know Fluzone is an immunization that we give annually. I usually ask my patient critical assessments. Have you gotten it yet this flu season? Also, are you allergic to eggs? Some people that are allergic to eggs, there can be some egg component in that. Another good question to ask is if you had any reactions to this in the past. So when I go back into my patient's room, I can ask those questions. So I've got the medication. It's Fluzone and it's not expired. It doesn't expire until 4/24. And I'm going to go ahead and pick up the appropriate size needle that I need. So I know for IM, the gauges are from 20 to 25 gauge, and the needle length is dependent on the size of your patient. I have a 20 gauge 1-inch needle, and that will work. So I'll probably give it in the deltoid. Our options are the deltoid, the ventral gluteal, which is the hip, and then the vastus lateralis, but that's usually mostly used for kids. So I've got what I need. I'm going to go ahead and do check 1. So I've got Chris Jones. I've got Fluzone. I'm going to be administering 0.5 milliliters, and I have a 3 milliliter syringe, so that will be appropriate. I'm going to be giving it IM today at noon. So I've got patient, drug, dose, route, and time. Same thing with our insulin. Before I do check 2, I'm going to want to go ahead and draw it up. So I'm going to, again, wash my hands and take a fresh alcohol swab and swab the top. And we do that to prevent any bacteria from getting into the vial. So remember, when you open this up, this end is sterile. We don't want to touch it, so kind of hang on to it. And when you open up your needle, that yellow part on top is sterile. So I'm going to connect the two, and you can go ahead and take your safety and pull it down to get it out of your way. Same thing with the insulin. I'm going to pull up in air what I'm taking out in volume. You can kind of see this syringe, it's kind of like a little mountain. The base of the mountain is where you should have your dose in the air. So I'm going to go ahead while it's down, inject my air, invert it, and I'm going to go ahead and pull up what I need. And same thing, I can draw back a little bit more than what I need because you can see in there I've got a little air bubble. So then, holding it, I'm going to flick the air bubbles back to the top, and then I'm going to go ahead and push so that I'm at 0.5. Okay? Again, using the scoop method, I can go ahead and there we go, to keep that clean. So now that I've done now that I've pulled it up, I'm ready to do check 2 on that medication. So I've got for Chris Jones, Fluzone, 0.5 milliliters. I'm going to be administering it intramuscularly 1 time today at noon. So check 2 is done on that medication. I recommend if you are doing multiple checks on medications, keep them very separated. So I've got my insulin over here to the left. I'm going to put my intramuscular in the middle. And now I'm ready to do, get ready my Lasix. So I'm going to go ahead and grab that Lasix. And I know to draw it up, it looks like I'm going to be giving this patient 20 milligrams of Lasix. And when I look at this, I can see this is 100 milligrams of furosemide or Lasix, and it's 10 milligrams per milliliter. So I'll need to know how many milliliters I'm drawing up to choose the appropriate size syringe. So if I'm giving 20 milligrams, I'll need 2 milliliters. So this 3 milliliter syringe will work perfectly. For that, I'm going to be using a blunt tip needle, and that's just to draw it up and to keep the end sterile because we'll be giving this directly IV push. Okay, so check 1, I've got Chris Jones, furosemide or Lasix, 20 milligrams. I'm going to be giving it IV push today at noon. Now, some things you need to know as the nurse about Lasix. It is a potassium wasting diuretic, so it will deplete the volume of the patient. A lot of times it's used for people that have heart failure or high blood pressure. So some critical assessments you as the nurse need to know is intake and output. What is their current blood pressure? Because it works in the kidneys in the loop of Henle, it's always a good idea to know what the patient's BUN and creatinine is prior to giving it. If they have an elevated BUN and creatinine, you might hold it or check with the provider to make sure it's safe to give. Because it's potassium wasting, a critical assessment is to check the patient's potassium. So I checked, and Mr. Jones or Miss Jones's potassium today is 4.0, so that's safe to give. If it was too low, you might need to call the provider to ask for some kind of a supplement because we know that this will bring it down even lower. My order on here says hold for a systolic blood pressure less than 100. So another critical assessment that we talked about is blood pressure. So when we go into the room, if it hasn't been done already, we will check a most recent blood pressure. It usually has to be within 30 minutes of giving the medication. Okay, so I've got Chris Jones for furosemide, 20 milligrams, IV push at noon. I'm going to go ahead and wash my hands before I draw it up. I always think about with IV, you really want to make sure that there's no air bubbles in the line because, if you're directly putting it into their venous system, you don't want to be injecting any air. Same thing, keep that end sterile. And if you contaminate it, no big deal, just get a new one. So I'm going to connect these two pieces. Before I go into the Lasix, we're going to clean the top vigorously, 3 to 5 seconds. And now I'm going to go ahead and put in air what I'm taking out in volume. We said 20 milligrams is 2 milliliters. Okay, we're going to go ahead and draw back. If I have any air, you're going to flick it to the top and push that air back in. You can only do that when you're still in the vial. Okay, so I've got my 2 milliliters, and now I'm ready to do check 2. So I'll take that back to my MAR, where I've got Chris Jones for furosemide. I've got 20 milligrams, which is 2 milliliters. I'm giving it IV push today at noon. So I've got all 3 medications ready to go. Now, when I get into the room, we'll have to verify our IV site looks okay. So we'll talk to our patient as we go through each of the medications. The things that I want to bring into the room with me are alcohol swabs and all of the medications. And if you needed to check a blood pressure, either a manual cuff or means to do that in the room. So we're going to go ahead and head back in. Forgive me while I adjust. Miss Jones, I'm back. How are you doing?
Okay.
I bet you're very hungry by now.
Yes, I am.
Okay, well, I've got everything ready, and then we'll get you your lunch. I know I just asked you this when I came in earlier, but do you mind telling me your name and your birthday again?
Chris Jones, 125XX.
Wonderful. And you said you're allergic to penicillin,
Yes.
correct? And no other allergies? No issues with eggs? Okay, wonderful. Any pain now, or are you feeling okay?
No, I'm doing good.
Okay, wonderful. So I've got the medications ready for you. Before I begin, I'm going to go ahead and scan your band. Get this going in. Okay, so I'm going to go ahead on DocuCare, if you can see, and I'm going to click on my first sub-Q medication. Okay, so I know that they just came in and checked your blood sugar and said it was 200. So we're going to be administering a little bit elevated today.
Yeah.
So I'll give you a little bit of insulin before you have your lunch. Okay, so let me go ahead and scan your band. And you just said Chris Jones 125XX, and that matches in my chart. So that's wonderful. So the next thing I'm going to do as the nurse is scan the medication so I can do check 3. So I've got my regular insulin, and I'm going to go ahead and scan it and hit scan. Okay, and we've got regular insulin. I've got 4 units of regular insulin for my right patient, Chris Jones. It's subcutaneous, and it's due right now at noon prior to lunch. So I typically will ask my patient, is there a spot that you'd like me to give you your insulin? Okay, so your options are your arm, your abdomen, or your leg. Okay, well, we'll do the abdomen.
You probably have the chart where it was last anyway.
Yes, I can see they gave it to you last in your arm. So I'll check your abdomen, and if it looks okay, we'll do there. So I'm going to go ahead and put on my gloves. And I've got my medication. And what we'll do is, because I'm not going to do this to poor Dr. or Miss Jones, I'm going to give the injection in here, okay? So if it's the belly button, make sure, or if you're using the abdominal area, make sure you stay at least 2 inches away from the umbilicus. So at least 2 inches on either side. So I'm going to go ahead and clean. So clean the area. I like to point the alcohol swab towards the area that I just cleaned as a reminder to where I cleaned. Make sure it dries. Don't blow on it. Don't do this. Just let it air dry. Now, if someone has enough abdominal tissue, enough abdominal fat, you can go ahead and go in at 90 degrees. If they don't, do a 45-degree angle. So I'm going to go ahead and go in at the 90. You're going to feel a stick on 3. 1, 2, 3. I'm going to administer the insulin. and hold, 1, 2, 3. And then after I take it out, I'm going to immediately engage my safety and get rid of the needle in the sharps box. And here's my sharps. Okay, you did great.
Can I eat now?
Almost. I've got 2 more medications, and then you can. Okay, so for your next medication, I'm going to be giving you your Fluzone. Now, since I've already scanned her ID, DocuCare remembers that, so I do not need to scan her again. I just have to click on my Fluzone before I can begin my 3rd check. So I've already scanned it, so it already verified that I'm in the correct chart, but I have to tell DocuCare that I'm going to be scanning the medication. So I've got my Fluzone for Chris Jones. I'm giving 0.5 milliliters. I'm giving it intramuscularly at noon, so I can go ahead and scan that and verify on here that I've given it the correct dose, route, and time. I didn't mention, but for the sub-Q and the IM, you can actually key in where you gave that so that the next nurse is aware of where you gave the injection. Okay, so I'll leave it like that. Now, typically, I like to give immunizations in the deltoid muscle. You could do vastus lateralis for kids, but is it okay if we do it in your arm?
Yes.
Do you have a preference whether we use your left arm or your right arm?
We're on my left side.
On your left side? Perfect. Okay. So for this one, depending on your facility, you may be aspirating or may not. We'll pretend that we're at Northeast Georgia, where in our policy for immunizations, we're not going to be aspirating. We will Z-track, which means you're going to slide the tissue over, so I'll kind of show that when we do it. All right, and to find the deltoid, remember, feel the acromion process, and it's 2 to 3 fingers or 1.5 to 2 inches below. So we'll give it right in that area right there. So same thing, I've got my alcohol swab. I'm going to clean the area and let it dry. With an IM, you can go in at 72 to 90 degrees, okay? Now to Z-track, before I go in, you're going to slide that tissue over. Let's see if we can do it on here so you can see it. So you're going to feel a poke on 3. 1, 2, 3. And I'm going to go ahead and administer the medication. Hold, 1, 2, 3. I'm going to let go, take out the needle, and engage my safety. Okay, so then we can get that away. If you've got a sticker or a lollipop for the patient, you can give it to them now for doing so well for 2 shots. Okay, I have one last medication for you, and I promise I'll let you eat.
Oh, yes.
Okay, so the last medication I have for you is your Lasix, and that was your medication that's going to help lower your blood pressure. And I saw my teammate Amanda was just in, and your blood pressure was 140/90. So it's okay for us to give. Just so you know, this might make you need to go to the bathroom a little bit more, so just make sure you call us for help because we are measuring, okay? All right, so I've got my Lasix. I'm going to go ahead and click on that. Then I'm going to administer it. If I can find it on here. Okay, there it is. Okay, so I've got for Chris Jones, I've got furosemide, 20 milligrams or 2 mLs. I'm giving it IV push today at noon for elevated blood pressure. The critical assessments we've already completed, blood pressure, BUN and creatinine, and potassium, all are within normal limits and it's safe for us to give. Now, since we're giving this in the patient's IV, another critical assessment for you to do is to check that IV site. So we'll check to see if it's patent by flushing it first, but you also want to use your nursing school skills. You can see on my model here, it's a little red. So if it was, I probably wouldn't use that line. I think that's just meant so we can see the vein. But you can ask your patient, are you having any pain at all there? Okay, and I don't see any redness or swelling. So that looks great. And we're going to go ahead and scan our Lasix. So we've scanned it. And now we've got Chris Jones, Lasix, 20 milligrams, 2 mLs, IV push at noon. So I've got with me alcohol swabs. I've got 2 flushes, one for before to check patency, one for after, and I have my actual medication. I recommend go ahead and opening these up. Now, saline flushes are pressurized. So if I just push up to get rid of the air, it's going to spray out. So a way to avoid that is pull back gently on the plunger and then push up so that you can see the fluid at the end there. And then you know there's no air. We're going to do that on both, so it'll be easier for us when we're ready to give it before and after. So I'll do the same thing. Now, another consideration when you're giving an IV push medication is how quickly that you can give it. So when I looked up Lasix under nursing administration, it says give slowly over 1 to 2 minutes. So that means when you administer the Lasix, we're going to give it over at least 1 to 2 minutes. Okay? So first things first, every time that you access the line, you need a new alcohol swab, and you're going to at least 5 seconds scrub the hub. And we do that to prevent any infections. Okay? So I'm going to go ahead and connect my saline, and I'm going to flush at least 3 to 5 milliliters to ensure that that site is patent before I put any medicine in it. So I go ahead and open up the clamp, and I'm going to flush it through. And I'll ask the patient while I'm doing that, are you having any pain? And I'm looking for any leaking, swelling, bleeding. Any pain there? Okay, so now I'm going to go ahead and clamp, and I'm ready to administer my Lasix. So again, we're going to grab a new alcohol swab. We're going to scrub the hub for at least 5 seconds. If it's a central line, you'll do it for at least 10 seconds. Okay? And now I've got my Lasix. So I've got 2 milliliters, and I know I have to give that over at least 1 minute. So this is where you would take out your watch, and you're going to do a slow push, stop over 1 minute. Okay? For the purposes of time, we're going to say a minute has gone by. I'm kind of slowly pushing and stopping. We'll give it over a full minute. And there's some medications that you might be standing here for 5 minutes, like for morphine or Dilaudid, where you have to give it slowly. Okay, so it's been a minute. I've given the 20 milligrams. Now I'm going to go ahead and take another swab. There's still medication in this line that we need to push through. So that's why we do that last one. So scrub it for a good 5 seconds. We're going to take that last saline, and then we don't want to push this too quickly through because there's still medicine in there. So this time when you're flushing 3 to 5 milliliters to clear the line, do it slowly, over about a minute or however quickly that you are passing the medication to ensure that A, they got all the medication, but also you're not giving it too quickly. It's really important at the end of this one that you lock the IV, because if you don't, you might have blood back up into the system, or you might lose your line if this clots here. Okay? So I am all done with your medications. You did wonderful. How are you feeling?
Can I eat now?
You can eat now. Now I will be back probably in about 30 minutes. I might be rechecking your blood sugar or checking to see how you're feeling. Your blood sugar and your blood pressure is what I would probably reassess. Your arm, it's normal to get a little soreness there. I have this sheet from the CDC that I'll ask you to read over, and I'll come back and go through it with you too. All right, thank you so much. I'm going to make sure that your bed is in the lowest position and that it's locked. Are you comfortable the way you're sitting?
Yes, I am.
Okay.
I'm ready for lunch.
Okay, and then your side rails are up. Here is your call light, and let's get you all situated for lunch.
Perfect.
All right, and that's it.